Hi there, welcome to my short and to the point video on celiac disease. This video is mostly meant for patients or anyone who wants a short and brief summary, but I also made a more in-depth one for everyone who wants more information. You can find the link to that video in the description. So let's get into it. Celiac disease is an autoimmune disorder where your body makes an immune reaction to gluten proteins which you get from eating glutens. And this will lead to damage of your small intestines. It commonly occurs in children from 6 months to 2 years, but it can be a little older. And the occurrence is 1 in 100 to 170 children. Those children who are affected may have gastrointestinal symptoms like diarrhea, abdominal pain, cramping, weight loss, anemia, and even lactose intolerance. And there may be malabsorption. Because your small intestines are damaged, it can be hard to take some nutrients out of the food you eat. So, how do you diagnose celiac disease? It is often very difficult, and the symptoms are not that clear, and it takes a long time for doctors to really know that it's celiac disease. And in this time span, it's important that you keep eating gluten, because as soon as you stop eating gluten, the autoimmune reaction won't trigger, your intestines will not be damaged, and your symptoms will be resolving. So then it's impossible to give you the diagnosis. So keep eating gluten. Then how is this diagnosis done? First of all, with some blood tests. They can do this EMA test and the anti-TTG test. Both are tests that can be done with some blood, and then they can look if you have deficiencies in your blood, so certain nutrients you didn't take because your intestines were damaged, like calcium for example. Then an upper endoscopy can be done, and then they can see the state of your intestines and if they show any signs of celiac disease. And also biopsy can be done, which is almost painless. And then the cells of your intestines can be looked upon to see if there's some signs of celiac disease. And then lastly, if it's still not clear after all these tests, a gluten withdrawal diet can be started. And if your symptoms are resolving when you're not eating gluten, then it's quite logical and clear that you might have celiac disease. So if it's clear that you have celiac disease, how do you treat it? It sounds simple, a lifelong gluten-free diet, but in fact it's really hard. First of all, if you don't eat gluten, then you're not triggering an autoimmune response and your intestines are not attacked, so they start to heal and all your symptoms will resolve quite quickly. But a gluten-free diet is quite hard to do. First of all, products that you buy which are gluten-free aren't really 100% gluten-free. They still have up to 20 milligrams per kilogram gluten, and it's unclear if this can damage your intestines and leads to a re-trigger of your celiac disease. Some recent studies showed that 10 milligrams gluten a day is safe, but more it's unclear where the strict border is of safe and not safe. So take that into consideration and be cautious with gluten-free products. Furthermore, gluten-free products are often not as tasteful, they are not as easily available, and this may lead to people cheating their gluten-free diet and leading to a re-trigger of the celiac disease. So this also makes it hard to eat completely gluten-free. Please do so, because otherwise you get your symptoms back. In a nutshell, these were the basics on celiac disease. If you're in need for more in-depth information, please check out my more in-depth video in the description. Feel free to subscribe for future videos, and thank you for watching.